All right, well, medical bills seem to be skyrocketing just about every year, but you may want to double check for errors. As CBS 2's Valerie Castro explains, experts say the medical billing process has become so complex, many people are paying thousands more than we should.
Jeremy Weintraub expected a scar and some discomfort after his hernia surgery.
Surgeon actually did a great job with it.
But the real pain came when Jeremy got a bill from the hospital for $20,000.
Horrifying.
Jeremy's doctor was in his insurance company's network. What he didn't know was that the hospital was not.
And we pay a lot for our insurance. To then have a $20,000 bill, I mean, we were horrified.
So the world of medical billing quickly gets very complicated.
Rebecca Palm is the founder of Co-Patient, a company that helps patients reduce their medical bills.
We typically find opportunities for them to save money on about 75 to 80% of the bills that people submit to us. So it's definitely worth a second check.
But hospitals don't make that easy for the consumers. They often send out bills with just a total amount due and no detailed information.
Errors in medical bills are incredibly common.
Palm says asking for an itemized bill is the first step to catching mistakes. Some of the most common errors are duplicate charges, charges for tests that were never performed, and inaccurate operating room fees. Patients should always try to make sure providers and facilities are in network. But if you are unconscious in the ER, it's difficult to ask those questions. So if you do get hit with out-of-network fees, remember, they are negotiable.
It's a little bit of a made-up number that's kind of artificially inflated to be higher than what any actual insurance plan is going to reimburse for that service.
Jeremy negotiated with the hospital and they ended up forgiving the entire bill. While grateful, he thinks something has to be done to fix the system.
Like a weird sort of game that I didn't know the rules for.
And state and federal insurance mandates have resulted in health plans with higher out-of-pocket costs. That means the stakes are that much higher, and catching an error could save you hundreds, even thousands of dollars.